She operated on her jaw and dental arch, and the change is impressive. Let's face it, looks matter. You want to look presentable and attractive in the eyes of others around you. This is especially true for kids and teenagers when the odd-looking gets one picked on, harassed, and bullied. That's why Ellie Jones decided to get braces when she was 14. However, that trip to her orthodontist began a sequence that would change her life and her appearance forever. You see, she needed more than just braces. Her jaw stopped growing when she was just 8 years old, and she needed to undergo surgery to correct it. A few years and a couple of surgeries later, her transformation will shock you. When she was 14 years old, Ellie Jones visited the orthodontist to talk about straightening up her teeth. Unlike most teens, she was told it wasn't as simple as just getting braces. The teenager from Rhyl, Wales, was instead diagnosed with a congenital facial deformity that meant her jaw had not grown since she was 8 years old. I was quite shocked at the diagnosis, but a part of me felt happy that I could get something sorted, Jones told Mamia. I was never self-conscious about my jaw because I didn't think or know anything was wrong with it, but I was very self-conscious about my teeth because, as you can tell from the pictures, they were very, very overcrowded. Now we know the reason why. The 20-year-old spent the following 6 years undergoing reconstructive jaw surgery to fix the problem, which involved cutting her jaw horizontally and vertically, as well as corrective surgery on her chin. It was a very scary time for me, as I've never been in the hospital for anything before. So my first time going was to have this massive surgery, which took over 8 hours, she said. My parents were told initially it'd only be 4 hours, so you can imagine what they must have been feeling and thinking when I didn't come out from the theater for over another 4 hours. The recovery was even more difficult. It was painful. It was more uncomfortable than anything. The fact that I couldn't move my head, face, or jaw because it was so swollen just felt irritating. I also had to eat and drink out of a syringe for at least a month afterwards, so that was really strange, she said. After the surgery, I had lots of dried blood in my mouth, which felt like I was choking when I was trying to sleep. After 6 weeks of liquids, she was put on a soft diet for 6 months after the surgery because she was unable to bite properly. While the surgery has changed Jones aesthetically, it's the internal changes that have had the biggest impact. I can honestly say that the surgery has changed me into the person I have always wanted to be, but couldn't before. I'm more confident, outgoing, and I feel I can wear the latest fashion. Before, I was always worried I would get stared at, she says. It has also changed my career choices in life. I've always wanted to be a photographer, but I always thought that being that close to people who would make me feel embarrassed, now I'm training to be one. She said that her newfound confidence was most visible in her dance lessons. I was shy, but now I feel really confident. It's changed my whole life. Miss Jones now wants to be a photographer, and her mother is supporting her ambitions. She said the surgery has not only changed the way Ellie looked, but also the way she portrays herself. Her confidence has grown, and she's blossomed into a beautiful young lady. Miss Jones' surgeon, Emma Woolley, said a lot of people don't actually realize they have a jaw deformity and just accept that they have difficulties biting. By not treating it at a young age, it can cause real difficulties later in life. I'm really glad the treatment has made a difference and given Ellie her confidence back. According to Jones's consultant, mallefacial surgeon Emma Woolley, more than 100 patients with similar problems are seen at the Glan Quid Center, but this one was particularly severe. A lot of people don't actually realize that they have jaw deformity and just accept that they have difficulties biting, but not treating it at a young age, it can cause real difficulties later in life, she told the Daily Post. While no one ever said anything about Jones's jaw pre-surgery except for a few snide comments from high school kids, the reaction to the results was entirely positive. See how this woman tried to accept herself. A Suffolk TikTok star who looked like a cartoon character because her top jaw was 8 millimeters too small and impaired her breathing and eating is learning to speak and kiss again after successful jaw surgery, which she documented for her online followers. Struggling with crippling self-esteem issues because of her grade 3 deformity, Kaylee Witherston, 25, says food fell out of her mouth and she could barely breathe through her nose because the gap between her top and bottom jaw was so significant. Bullied at school, as despite wearing braces, her lower teeth jutted out so noticeably, finally in April 2022, she had a 3-hour operation to successfully pre-position her top jaw. 5 weeks on, she's sharing her new look and her plans to tie the knot with the love of her life. Trainee emergency medical technician, EMT, Rebecca, 27, with her 19,400 followers on TikTok. Kaylee, who lives with her fiancé in Suffolk, said, "Rebecca has been there for me through everything, and now I get to marry her with my new jaw feeling authentically me." From a young age, Kaylee knew that she would one day need surgery to correct her jaw, an operation that could not be performed until she was an adult and had finished growing. She said, "I grew up being told my face was wrong and it would need fixing. I didn't really understand, but I would just tell people I had a mouth syndrome." But it was not just her appearance that was affected by the 8-millimeter gap between her top and bottom jaw. Her ability to eat and breathe were also impaired. She said, "I couldn't eat certain foods, like a lot of meat, because I couldn't grind where my molars didn't meet. I would be so embarrassed at friends' dinner tables because I would be chewing and chewing and I'd have to spit the beef into a napkin. I started to wonder why I was so different to everyone else." Unable to grow any adult premolars at the age of 8, Kaylee had surgery under general anesthetic to remove 8 baby teeth, leaving her with 4 major gaps. This was the first of many issues she had with her teeth during her early childhood and teens. She said, "Because of the huge overbite, my teeth started to compensate for not being able to eat properly and began spreading out," she added. "My teeth basically moved up and out 8 millimeters to try and create some form of bite. I was bullied continuously. I was called buck teeth every day, and the other kids at school would say anything they could about my teeth that was hurtful. It destroyed my self-esteem as a young adult, too, because not only had I grown up with people calling me ugly, but I knew that the reason my teeth were the way they were was because of biological difference, which meant I didn't feel normal." Having her first brace fitted when she was 12, it signaled the start of a decade of dental appointments and checkups every 4 to 6 weeks, and she was prepared for surgery sometime after puberty. She said, "Within 1 month of having my first brace, all the gaps in my teeth had closed, and they were straight. It was amazing, really." Sadly, her 8-millimeter overbite was still there, continuing to affect Kaylee's daily life. She said, "I would avoid eating out at all costs, and if I did, I always kept my hand in front of my mouth. Biting into a burger, I would end up taking the contents out, and it would fall apart out of the sides of my mouth because my jaw was so much bigger than it should be. I felt like this over-exaggerated cartoon character at the dinner table chewing on my food." Only now that her top jaw has been corrected has Kaylee realized how seriously her breathing was affected by her overbite. She said, "I was never able to take a deep breath through my nose. I would always breathe through my mouth. I also had jaw pain constantly. By the end of the day, my jaw would always start to feel sore." Kaylee's insecurities also made dating a no-go until she met her fiancé through friends in 2016. She said, "I wouldn't dare go on a date or eat in front of someone. It was just way too stressful for me. The way I kissed people was different too because my top jaw was so small and my bottom jaw so far forwards, I was always so conscious of it." She added, "People would often assume I was underage because of my braces as well, which was so frustrating. I just saw myself as this alien because I couldn't see myself as pretty. When I met Rebecca, we just hit it off and she taught me to realize that there is beauty in everything and everyone." On the waiting list for an operation since she turned 18, Kaylee was finally booked for an appointment with a surgeon at the beginning of this year and given the go-ahead for April. She said, "I always knew it was going to happen, but it didn't feel real until then. I kept telling myself it'll be fine, and there are people going through worse, but I was definitely scared. My face was going to change, and that was what everyone sees." Luckily, initial plans to perform double jaw surgery because of her bottom jaw protruding 2 millimeters were changed. Instead, Kaylee was told she could have just the top jaw operated on, reducing her recovery time by half. During the 3-hour operation, surgeons drilled underneath her eye sockets to detach her upper jaw and move it forwards to the correct place before securing it with titanium plates and screws. Amazingly, left with no scars, the operation was a success. She said, "I was out of it when I came into my hospital bed because of all the medication and was wearing an ice pack face mask to stop the swelling. I felt very emotional and overwhelmed. The first week of recovery was really hard with the swelling and not being able to eat." Her new face also had given her the confidence to become a full-time content creator on TikTok. She said, "I used to need a full face mask up just to put my camera on to speak because I was really embarrassed and I wasn't being my true authentic self." Kaylee added, "I used to contour my jaw and try to make it appear like it was further back, but I don't feel the need to do that anymore. I just pick up my camera and do what I've always wanted to do." Now, Kaylee and Rebecca are planning their wedding, which was initially delayed by the pandemic. You can see Kaylee's TikTok page here. Another hard journey ends like this. See how this young woman feels now. Lillian Roman was a 20-year-old college student when a trip to the orthodontist led to a devastating diagnosis. She has idiopathic condylar absorption, ICR, a condition in which the body absorbs bone tissue in the jaw. By her 21st birthday, her condition was so severe she could no longer eat solid food, was malnourished, in constant pain, and even suffering from breathing difficulties. The only option was an excruciating 7.5-hour-long operation in which surgeons separated her top jaw from the bottom, repositioned it, and replaced the joints with titanium prosthetics. I realized that if I couldn't find somebody to fix it soon, I would live the rest of my life in agonizing pain, unable to breathe and rapidly losing weight, Roman, now 22, told Newsweek. She documented the painful journey on TikTok and recently celebrated the first anniversary of the $100,000 surgery that brought her smile back. The Cleveland Clinic describes condylar resorption as the breakdown and loss of bone in part of your jawbone and jaw joints. People with ICR experience gradual bone loss in their mandibular condyles, which are the rounded ends of the lower jaw near the neck. The mandibular condyles connected to the temporomandibular joints, TMJs, which in turn are connected to the skull. Roman was fitted with her first pair of braces at age 8. They were removed when she turned 14, but despite religiously wearing her retainers, her teeth began to move. At age 15, Roman noticed that her jawline had begun to recede. She developed an overbite along with an open bite, where the front teeth do not touch when the jaw is closed. I would mention this to him, and he blamed me for not wearing my retainers. My problems were continuously dismissed, so by age 18, I decided to stop seeing him. Roman had her wisdom teeth out at 16, after which her jaw seemed to shrink even further. Over the next 4 years, her symptoms continued to worsen, and she developed pain in her right temporomandibular joint. She returned to the orthodontist, who was stumped. He recommended that I see a different orthodontist with better technology to figure out what was going on, because to him it was a mystery, Roman said. The new orthodontist took one look at my bite and suspected joint degeneration, so he referred me to an oral maxillofacial surgeon for additional testing. In the months leading up to the surgery, Roman's overbite was so extreme her teeth no longer made contact. When I bit down all the way, I only contacted one tooth in my whole mouth, my second right molar, she said. When I bit down all the way, I only contacted one tooth in my whole mouth, my second right molar, she said. This eventually traumatized and infected the tooth and caused excruciating nerve pain on the right side of my jaw, even after the infection was cured. As well as the constant pain, Roman was also experiencing breathing difficulties. As the condyles continued to break down, her jaw began to swing backward and block her airway. She couldn't sleep at night and was chronically fatigued. I knew it was my only chance at getting my old quality of life back that I had as a kid before the disease progressed, she said. No other choice. Unsurprisingly, the diagnosis was overwhelming for Roman. She visited 5 separate surgeons who all recommended different treatment plans. One recommended double standard jaw surgery, which would correct the deformities and realign her jaws, while another suggested total joint replacements. After conducting her own research, Roman discovered that unless the diseased jawbone was removed, the odds of her condition relapsing were high. I decided to consult with Dr. Stephen Sullivan in Oklahoma City, since he is one of the most renowned surgeons for ICR-related procedures, she said. He confirmed that I had severe degeneration in both TMJs, and that there was no other option but joint replacements to restore both my function and aesthetic. By the time her surgery date rolled around on January 21, 2022, Roman was excited to have the operation. However, the risks were high. If the operation had been unsuccessful, Roman could have been left in further pain and without part of her jaw. As she is allergic to nickel, titanium prosthetics were used to prevent Roman's body from rejecting the new joints. The surgeon removed the diseased bone from Roman's lower jaw and replaced the joints with titanium prosthetics. He also performed a left 3-piece maxillary, which involves separating the top jaw and repositioning it. Fat was taken from Roman's stomach near her belly button to fill the gaps left by the diseased bone. The fat acts as a blocker, preventing the bone from growing back and causing a relapse. Although Roman had been desperate for the surgery, the first month post-surgery was hard, as it took a week for her to recover from the anesthetic. I remember crying harder than I've ever cried in that first week after surgery, thinking I had made a huge mistake, she said, but I would look at myself in the mirror every time I walked past it and I'd see myself. Even with all the swelling, I could see that how I was supposed to look at 21 had the disease never altered my face so significantly. Showering, talking, and brushing my hair and teeth were so difficult, she said. It took me months to recuperate my energy and do everyday tasks. For the first 8 weeks post-surgery, Roman could only eat liquid foods while her jawbones fused. She then began to introduce harder foods into her diet, working her way up to solid food. Her face stayed noticeably swollen for 6 months and didn't fully return to normal for a year. She also needed intensive orthodontic work to move her teeth into the correct position. Roman's braces were removed in October 2022, and now, a year in post-surgery, she's happier than ever. She can eat anything she likes and has returned to a healthy weight. I'm extremely pleased with my decision and grateful I was able to have the surgery, she said. It's been life-changing in so many ways.